welcome everybody. Thank you very much for joining us for the Support Hub today. Delighted to be joined as always by Tahmina and today by Vikki Moyse, and we're going to be talking to you today about EDI in the workplace and embedding it in your training offer. So we wanted to discuss some different things during the time that we've got with you today. So I'm going to start off with a few slides around EDI and just some of the nomenclature, some of the words, some of the terms that we use when we're talking about EDI, just as a bit of a recap and a refresher. And then Vikki's going to take over and present some slides to you about the training that they do in her organisation and about the award they won last year about embedding EDI really well holistically across the organisation. And then Tahmina's going to come in at the end and she's going to talk about what work the EDI group are doing from the Institute and where you can find some resources to support you as well. So if you haven't been to a support hub before, you'll notice that your microphone and camera are both off. We can turn the microphones on as the presentations are happening. And then if you want to chip in and ask any questions, you can do that. If you'd like to put any questions in the chat or comments as we're going along, we can address them or we can pick them up at the end. So first of all, I wanted to just go through some of the terminology that we might use when we're talking about EDI, just to check that people are happy with the different terms that we use. And if anybody's a little bit newer to this area, just to hopefully help with understanding and being confident in using some of the terminology. So you might notice when you're looking at documentation, some documentation talks about equality and some documentation talks about equity. So I just wanted to go through the difference between the two words. So the HCPC standards of proficiency still talk about equality, diversity and inclusion. At the Institute, we talk about equity. So I just wanted to recap what the difference is between those two terms, first of all. So equality is the idea that you treat everybody the same. So everyone has the same opportunities, you treat them all in the same way. And in principle, that sounds like a good thing to do. But equity takes that further and recognises that everybody is different. Everybody's needs are slightly different. So rather than treating everyone exactly the same, we understand the individual and then we have some adjustments or we make some changes. And that will help that person because it's tailored to them. So rather than treating everyone in exactly the same way, we understand that everybody is a bit different. And we think about that when we're thinking about making any adjustments and helping that person to do whatever it is they're doing as well as they can. So equity, in a nutshell, is about treating people differently, but in a good way, because you understand that they've got differences. All of us are individuals. We're all very different people. And any adjustments you might need to make, you have conversations with them about how that will support them and how that will accommodate their needs the best. So a really simple analogy, but I find quite useful when you're thinking about some of the terminology for EDI, is highlighted by the shoes on the right hand side. So it might seem like a silly analogy, but I think it's quite useful because it's quite easy and it's quite accessible. So thinking about footwear, equality is about getting everybody a pair of shoes. So if we're going to treat everybody equally and treat them all the same, everyone will get a pair of shoes. It might not be the best pair of shoes and they might not fit you and they might not be your style, but we all get a pair of shoes. Diversity is accepting that everybody likes different shoes and everybody gets to wear a shoe that they like. So you don't impose the kind of shoe, they get to bring their own shoe and they get to wear the shoe that they like the best, and it can be any style that they want it to be. Equity is getting everybody a pair of shoes that fits and also in a style that suits them and that they like. So equity is different to equality in that you take into account everybody's individual differences and you make the adjustments so that it works better for them. Acceptance of people is about understanding that we all wear different shoes, we like different things, and we express ourselves in different ways. So accepting people's differences is a really important part of EDI and thinking about how we work with each other. And then a sense of belonging is about wearing whichever kind of shoes you want to, and you're not judged for it. So you can do whatever you want, you bring your personality to work and you work in a way that's appropriate, but that you have your individuality and that's respected by colleagues around you. So nice, simple analogy to get us going, thinking about some of the terminology we're going to go through in this first bit. So thinking about diversity in a little bit more detail, really diversity is about celebrating people and embracing differences, and it's making a space for those differences in the workplace, in your own personal life. So we are all different. We need to accept that everybody is different and understand that that's a strength. It's a really good thing to have lots of different people contributing to the workplace and also in your life generally. So recognising and respecting that everybody is different and celebrating that diversity is a really good thing to be able to do. It creates a really positive environment And it enriches what we do because you get lots of different perspectives being brought in. And it also helps with communication. So if we understand each other better and we celebrate those differences and we have conversations with each other, then it improves our communication because we're talking to lots of different people with different backgrounds. So we all benefit by diversity in the workplace because we have different perspectives, we have different age groups, we have different experiences, and everyone brings that to the discussions that you might have. So diversity is that range of different experiences that people bring with them. It can be lots of different things. I've just put some of them on the bottom of the slide here. It covers lots of different things that people can have that are different. So it could be their ethnicity, it could be any beliefs that they might have, it could be what age they are, it could be sex or gender, it could be ability, disability, it could be a socioeconomic background. So all of us are different to each other. We all have slight differences. And the key thing with diversity is acknowledging that and celebrating that and making everybody feel welcome. So that leads nicely onto inclusion. So inclusion is all about understanding that people are different, but creating a culture and an environment where everybody feels that they're safe and secure, everybody feels welcome, and everybody feels able to be themselves. So if we're thinking about inclusion, it's something that we need to do actively. We can't assume that people know that they can just be themselves. It's about our behaviours. It's about us being positive and receptive to people and understanding that they may have things that are different to us, but that's absolutely fine. So again, I've got a definition here from a website that I've put the link at the bottom of the slide for you. And it says inclusion means more than just letting someone in. It means that they're not only allowed into the room, it means that you design the room so they feel comfortable to stay, to speak, and to be included in the conversations. So inclusion is about making people feel that they're welcome, that they're acknowledged, and you do that in a very active way. So next time you're thinking about inclusion or you're discussing inclusion, if you're in the workplace, just have a think about when you talk about it, who's actually in the room with you? Are there any people who are missing? Is there anybody who's quiet? They don't feel able or confident to be able to give their opinions? And who's working twice as hard to be seen? So just because we have people in the room with us, active inclusion is about noticing. It's about giving everyone the opportunity to have their say. It's about everybody feeling welcome to be in that space and confident to contribute to the discussions. So thinking about active inclusion, don't assume it's just happening because you have a diversity of staff that are around you. Think about those more formal occasions and people being enabled to be confident, to have their say and to feel listened to. And that brings us on to allyship. So if you are aware there are some people who sometimes aren't in the room or they don't get to have their say and you want to support them, it's really important that we all think about being an ally. So if you notice differences and you don't step in to help, then it means really you're a bystander. You're not doing anything to support those people. But being an ally is about taking steps, and they can be quite small things, but they're supportive things that you do, that you make sure anybody who is disadvantaged or has any barriers to being in the room, to being heard, all of those kind of things, has some support. And it doesn't need to be confrontational. It's not about you stepping in and saying, stop doing that. That's not appropriate. It's not necessarily about having that confrontation. It's about being supportive of people, noticing if they're not able to express an opinion and supporting them to do that. So most of us understand that that's a good thing. Most of us would like to think that we would do that if we saw something that wasn't appropriate. We would say something. If we see that somebody needs some support, that we would do something. But it's important to make people with traditionally marginalised identities feel that they are included and supported. So you can't underestimate how important it is to be an ally for other people, and to show them that you're on their side and to support them in some of those more formal settings. And if you look at research, it shows that allies don't just influence the one person that they're talking to, they inspire other people to make changes as well. So when people see that really positive behaviour and supporting others, and doing that in a very positive way, then it can help other people to take on that mantle and to do the same thing as well. So you can act as a change agent. You can use your behaviour as a positive model for other people to copy. So as I said, it doesn't mean saying that you intervene and say that's not appropriate and you have an argument with somebody. Being an ally can be much more subtle than that. So you could think about a situation where you feel somebody isn't being listened to or isn't being heard, and you can say, I think that this person just made a really valid point. Should we just ask them again to say that? Or you repeat what they've said and you say, I think that's a really good idea. I think that's a really valid point. I think we should listen to what they've got to say. and you make situations where everybody feels able to contribute. And if you see that that's not happening, then you can step in a really positive way, non-confrontational way, and give them that support. If you notice it's happening and you don't do anything, then it makes that person feel a bit invisible. So it's about them knowing that you've seen it, you've heard it, and you are supporting them to try and get their point across or to feel more valued in the workplace. So we can use allyship in different ways. It can be on a one-to-one. It could be just talking to an individual. So it could be thinking about your own actions and learning more about how to be an ally and positively changing your own behaviour. But as I said, it is about modelling behaviour to others. So I know from the people that I saw entering into the support hub at the beginning, we've got people from laboratory managers through to training officers through to people who may be candidates. It doesn't matter what your position is at work. You can be an ally whatever your position is. If you have a hierarchical management structure, that doesn't matter at all. Everybody can contribute to being a supportive ally for others. So think about your behaviour and modelling that good behaviour for other people. And thinking about if some people are not like that, maybe about changing their mindset, why they're not engaged with it, or is there something that means they're not acting as an ally or actively going the other way? And does that need to be challenged in some way? It could be interpersonal. So it could be that by being an ally and making that an obvious positive thing that you're doing, you support other people and push to the surface some day-to-day challenges that other people may have. So it may be that because you're modelling that behaviour, it helps other people to do it, but also it helps to support through maybe some procedural things, maybe some things that are happening in your laboratory that mean that it's a much more positive space for people that it may not have been up to that point. And then if we go to the furthest extreme, those different behaviours, modelling those behaviours and being an ally can help to change structural organisation. So if it is a formal meeting setting and you're modelling those behaviours, then it can modify the behaviour of other people. It can affect the norms and the behaviours of others. It can also start to affect policies and the systems in which you work. So by demonstrating these behaviours, it can have a really positive impact on the person, the individual that you're supporting. It can have a really big impact on the team that you're working with. And eventually, it should be informing the policies that you're doing. So we're not doing these things because we have to, because there's legislation. That's not what the EDI session is about today. It's about knowing what is a good thing to do and feeling confident to do that. And then Vikki and Tahmina will talk about things we can do to support you to evidence how you are doing that. So all of these things are things that are probably familiar to you, just having a recap of the positive things that can come out of doing them in the workplace. So acceptance and belonging, we had on the shoe analogy, they're kind of linked together. So belonging is about everyone feeling valued and accepted and celebrated for who they are. So they can bring them whole selves to work. They don't have to modify their behaviour. They don't need to change who they are, that they feel confident that they can be themselves and they'll have a sense of belonging in the workplace. And acceptance is all about making those people feel that their contributions are going to be valued, they're important, that you're listening to what they have to say, and that then enables people to reach their full potential. So by accepting people, acknowledging their differences and giving them that sense of belonging, it means that everybody, no matter what their background, no matter what their identity or circumstances, they can contribute fully to the workplace, they get much more out of it, and you also get much more out of it. So that sense of belonging is really, really important. And then that again leads on to representation. So representation, I think, is encapsulated really clearly in this quote. You can't be what you can't see. So it could be in your workplace, there are people in different positions of authority, or they do different roles. If you have people in who are more early career and they don't see themselves represented in those roles, can be quite difficult for them to see how they could get to be in that place. So that could be to do with mentoring, it could be to do with supporting them, but being able to see people that look like you, sound like you, behave like you is a really positive thing to help people see themselves going forwards in their careers. So again, have a think about in your setting. Do you have people that represent a lot of others in the workplace? It sometimes changes as you go through senior management, but can you see representation for people? It's really, really important for people, again, who traditionally might come from a marginalised background and don't see themselves belonging. If there's somebody that's similar to them, that can really help them. They've got a similar background, they've got to a particular position, and it inspires them to think that I can do that too. So if you do have a lack of visible role models, it can lead to feelings of exclusion and disempowerment by certain people because they can't see anyone who's succeeded in their role. So it's really important to have some of that representation. And that's some of the things that Tahmina will talk about. We've got resources to help around that from the EDI group. So when I talk about EDI, I don't want you to think it's something else to do. It's something else I need to fit in. We know that everybody is massively busy, and it's not something else we're asking you to do. It's something that you should feel confident that you know what you're doing. It should be something you're demonstrating in your behaviours, in the way that you work every day, and it's something that you're modelling for others. So when you're talking to people, if you're talking to candidates about their registration training portfolio, for example, or somebody about their specialist portfolio, when it comes to the piece of evidence around demonstrating EDI, it's all about them demonstrating how they engage with it and what they do in their behaviours. It's not, I know about legislation, I know about a piece of documentation that's from our trust. And Vikki will talk about that in her presentation as well. So some really good examples of how do you show that they are engaging meaningfully with EDI in their documentation. And as somebody who's a training officer or training manager who's really busy, how can you meaningfully engage with it to support your candidates when they're getting their pieces of evidence together? So again, just a little bit more on this before I switch over. I'll stop sharing and hand over to Vikki. Thinking about EDI as equity, diversity and inclusion, remember it is an active thing. It's not something that's just going to happen, it's just going to be there. It's about actively being involved with it, modelling those behaviours and demonstrating that in your own practice, because anyone who is registered on the HCPC register as a biomedical scientist also needs to demonstrate the standards of proficiency. So it's about you being comfortable and confident if you were audited by the HCPC that you feel that you can talk about EDI in an informed manner and how you do that in your own work and how you can demonstrate you meet those standards. So just some things to think about when you're thinking about EDI in your own work and your own behaviours. Some things to think about. Being approachable and being open to learning is really, really important. None of us know everything. We all have our own experiences that we bring to work and that make us who we are, but we don't all experience everything. We don't all have the same backgrounds. So it's important to be approachable and to be open to learning and asking questions. As long as you are curious and courteous when you are asking people about things or they're sharing information with you, that's fine. People sometimes paralyze themselves by not wanting to say the wrong thing, don't want to put the foot in it, so they don't say anything, and then we don't move forwards. So thinking about being approachable, being really open, being happy to ask questions, being courteous and respectful if you're asking people questions about any differences, and don't make assumptions. So don't just judge a book by its cover, as the old saying goes. Don't think that you know things based on how someone behaves or how they dress or any of those outward displays. It's about understanding that person as an individual and having time to talk to them. And being an advocate and demonstrating yourself in your own behaviours and actions, your commitment to EDI, and that you do display all of these behaviours is really helpful for people that you're working with, because they know that you're somebody they can come and talk to, and they know that you're modelling those behaviours and they might aspire to be like you. So don't underestimate how positive an impact it can have, just having all of those kind of things that you do in the workplace. And another really good quote that I've heard quite a lot is, we need to get comfortable with being uncomfortable. None of us know everything. We're going to be maybe put on the spot sometimes. Maybe we need to stretch ourselves and learn a little bit more about things that we're not as familiar with, and that's okay. None of us know everything, and people are very forgiving and understand that you don't always understand everything. That's fine, but you need to be comfortable with being stretched and having to ask questions, finding out a little bit more. That's just life. We do that with other things. So I wanted you to feel empowered to do that around EDI in the presentation today. So just a couple of things that help to support this change. So I'm sure you're all very familiar with the standards of proficiency that were updated from the HCPC in 2022. A big change in focus was on EDI. So I'm just going to go through this briefly because Vikki's going to talk about it in detail. So as well as the standards of proficiency, which the registration training portfolio is focused on, the standards of conduct, performance and ethics were also updated in 2024. And again, they have much more focus on EDI. And then coming this year, the HCPC standards of education and training are also being updated. And these are the areas that they're going to focus on at the bottom of the slide. So we've got artificial intelligence, simulation in learning, equality, diversity, inclusion, because that's their wording, and different models for learning. So you can see in all of the standards that the HCPC have across their professions, EDI has a much bigger focus than it used to have. So all of us feeling confident and competent that we can demonstrate those behaviours is going to be really important. So just briefly, before I hand over to Vikki, just to highlight the changes, if you've got people who are going through version 4 compared to version 5 portfolios, there is a big difference in the amount of EDI information and standards that we're asking them to demonstrate. So in a version 4 portfolio, there were only 3 standards of proficiency that were based around EDI. In the new portfolio version 5, there are 15 of them. So again, I've just put a link to the standards of proficiency if you need to go and have a look if you're not as familiar with them. So it's around us. The regulator has changed their focus on EDI. So as practitioners, everybody needs to be familiar with and confident with demonstrating it for myself and also helping others to demonstrate in their practice as well. So last thing on the standards of conduct, performance and ethics, again, if you're not quite as familiar with them, I just wanted to flag to you the areas where they've put in EDI considerations. So these are just subheadings that are within the standards. And again, I've put a link at the bottom of the page so that you can go and have a look if you, again, wanted to find them. So the updated wording in the standards of conduct, performance and ethics that were updated at the end of last year talk about treating service users and carers with respect. I would hope most people are doing that anyway, but that does link into EDI, understanding differences, sense of belonging, acceptance, all of the things that I've mentioned earlier. Challenging discrimination, if you come across it, whether that's just within your laboratory, whether that's outside, with other people who work with you but are not in your laboratory. If you notice it, it is your duty to do something about it, not just to pretend it didn't happen or ignore it. Maintaining appropriate boundaries, again, kind of links to EDI considerations and to working professionally. And then the use of social media. So again, not having any views that are clearly discriminatory or unpleasant and all of those kind of things. So just being careful about using social media. So I just wanted to flag those for you, just in case you weren't as familiar. So the key thing I wanted to say really before I end my bit is, when we're thinking about EDI, it really is about a holistic approach. It's about you thinking about yourself and developing others, whether that's students you have, apprentices or colleagues that are working with you in the laboratory, to create people who are empathetic and well-rounded biomedical scientists. And they can work with a variety of people, whether that's patients, colleagues, service users, others in the laboratory. It's really important that as more senior people, we're modelling those behaviours. And if it's people who are newer to the profession or they're training, that we're helping them get to grips with it and thinking about it's just what we do. It's not something separate. It's not something other. It is just part of who we are. And this is what we do. This is how we do this in our workplace. So integrating EDI and being active in showing those behaviours, making sure that you tell people what's expected of them, and tackling things if you think that things are not okay is really important, because by having that holistic view of it and making it part of everyday work, it means that your actions are preparing everyone that you work with to be really effective biomedical scientists who clearly meet the standards that the HCPC have got around EDI. Okay, so that's the end of my bit. So what I'm going to do is I'm going to stop sharing, Vikki, and I will hand over to you to seamlessly take over with your bit on your slides. And I will mute and I will help answer questions if that's useful.
Okay, can you see my slide?
Yeah, it's working fine.
Excellent. Okay. Thank you very much, Sue, and afternoon, everybody. I have been asked to talk a little bit today about how we've embedded EDI into our training, as Sue said, and also at last year's IBMS Awards, we were absolutely thrilled and surprised to win the EDI entry. And I wanted to talk a little bit about what I said in our entry, which really helped us to think through what we've done and what we're going to do in the future as well. So hopefully that might be helpful to some of the people on the call. I want to start by saying I didn't make the application for the awards because I sat back and thought, we're great at this, we've got it all right, and we do everything perfectly. As Sue said, there's a lot of things to learn, and that sometimes this can be quite a difficult area when it comes to planning, especially things like training and producing evidence. Because people want to get things right but aren't always sure what kind of things to put forward. So the first thing that I wanted to mention was we don't really do this in isolation. So I'll talk a little bit about lab specific things that we do in a second, but we looked at our organisation as well, because when we look at things like legislation that's in place, which you will do if you're putting people through the portfolio, we also look at the organisational structure and support that's in place as well. And if this is something that maybe you're new to planning, or want to look at what else you can do, looking at your wider organisation can really help you. And we've got lots of resources across our organisation that aren't lab specific. And because there's so much useful information across organisations, sometimes it can be difficult to know what all of it is all of the time. So if you go and have a bit of a dig around, maybe on your intranet or wherever else people share information, if you've got Teams channels, that kind of thing, sometimes it's quite overwhelming because there's so many of them. We've got hundreds of Teams groups. I don't profess to know what they all have in them, but we do have quite a few resources that are shared across our organisation, which really helps us to then plan laboratory focused activities, and we can also use them for training and evidence. Also, it's really important to have some support, I think, around initiatives. And as Sue talked about, some of the activities are about creating an environment for people. And it's really difficult to create a positive environment if you don't feel like you're supported by the leadership team or the overarching organisation. And we want the trainees and our colleagues to feel that that is the case. So highlighting what the organisation has in place, even if it's not something people necessarily go and look at every day, is quite important for us for helping to create the right kind of tone and environment. So we looked at our organisation. We're very lucky in that a few years ago we had a person appointed specifically to help to gather feedback from people and to implement policies and processes and activities around different elements of EDI. And he's done a really fantastic job, and it's a really positive thing to see. So we've got organisational policies, which again is something that we start with when we look into how to train people, particularly for the portfolio module. And there's definitely an element of colleague engagement. So one of the things I wrote about quite a lot in our entry was a lot of what we have done across the organisation and plan to do in the future started with colleague engagement and asking everyone that works with us and in our teams, how do they feel about the place that they work? Do they think we've got work to do? Have they got suggestions? And this is definitely a thread that carries through for us. And one of the things we try and do with our trainees is to talk about this and whether they feel included and whether they think everybody they know would feel included. So that was a big part of our entry, because our organisation has made quite a lot of effort to listen to feedback from people that work within the organisation, and we thought that was really positive, and actually was something that started to create the change in culture and environment that we've seen over the last few years, because it encourages people to speak up and it encourages people to put forward ideas. As Sue described, that's quite an important part of the things that we documented. So we did have a strategy, we have a policy. So I mentioned how that's communicated to staff and how colleagues are able to feed into that. And out of that has come a lot of groups and activities. So we have lots of different areas of our Teams system that have various groups that celebrate lots of different aspects of diversity. So as Sue mentioned, it could be almost anything that are differences between individuals, and we have people in the lab who get involved in some of these things. So that's everything from activities for Pride, for example. We have a group that's just been set up recently for staff members who are neurodiverse and can come together and make suggestions for the organisation. So there's a whole list of groups that people get involved with, but having those set up in the first place and having an environment where people feel they can suggest making those was something that we talked about quite a lot in our entry. So definitely tap into the resources that your organisation has. Don't feel like this is something you have to start from scratch in the lab and it has to all be lab based, because it doesn't all have to be done just by you as a trainer or you as a lab leader or even a colleague in the lab, and it can help you find a basis from which to build from if there is already information and activities in your organization. Oh, let me just swap to the next slide. Sorry, too many buttons open. So then we looked at what do we specifically do in the lab, and this is where we start to build things into our training, because it's not just about material to take the trainees through, it's also about making the trainers feel confident that they have activities or things that they can go through with the trainees. And we wanted to show how our lab interacts and engages with the organizational elements. So this is something that we apply and probably a lot of people apply across lots of different elements. So for example, you could have an amazing quality system, but if nobody knows how to use it or where the processes are, it's not such a great quality system. If things just sit at a high level and don't actually sort of filter down into teams and into everyday activities, then it doesn't necessarily mean much. So we looked at how the laboratory engages. We participated in activities, some of the teams that I mentioned already. We had a lab-specific focus on the International Day of Women and Girls in Science, which was quite exciting for us. And it's about trying to encourage staff members to come forward, make suggestions and be involved where they feel able to. So we wrote a lot about that in our entry and the engagement that people have had with various activities. We also have mental health first aiders in the labs, and they've contributed quite a lot to making suggestions in the workplace. And we find that this is something that people talk about in their portfolio evidence a little bit. So we try and highlight lots of different ideas to give the trainees something to write about. And one of the reasons that I put in the entry in the first place actually was our trainees' portfolio evidence. That's what gave me the idea. What we do, I'll show you a slide in a second and give you some information on the suggestions that we make to the trainees. But one of the things that I noticed is we give the trainees a range of different things that they could complete as evidence. And some of the activities are quite legislation focused, as you can imagine, talk about policies, talk about procedures. And that's sometimes a bit of a safer choice because there's something to go and look up. There's something very tangible to go and write about. But it's not necessarily everyone's cup of tea, and it's quite a dry piece of evidence sometimes. But what I find time and again is that the trainees choose to write about their team, and they choose to write about how they feel working in their team. And they choose to write about diversity within their teams, and we don't make them do that. And that's one thing that really was the inspiration for adding our entry in the first place, was if our trainees choose to do that without us sort of pushing them to do so, and they do have other options, that's got to be a positive thing, I think. They want to write about how they feel at work and how they work with their colleagues, and they produce some really, really lovely pieces of evidence. And that's what I sent in with our entry, some examples of those. So what we do when we go through things with the trainees, we have a few things that we do to try and embed this in our training. We get our trainees together and we do a bit of a tutorial because we find that it's the kind of topic that sort of invites discussion. If we're encouraging people to talk and to put their views forward, being approachable and open to learning, as Sue said, is something that we're very keen to make sure as part of our environment. Getting the trainees together for a tutorial is always a nice way to go into this topic because it encourages people to come and talk, to share ideas, to ask questions. And we go through some of the national legislation and the trust policies, but also we talk about what does inclusion mean to everyone individually. And we often come down to the question of, do you feel like you can be yourself at work? what does that feel like for you? And if there is a reason why you don't feel like you can be yourself at work, what might that be? What would help you to feel that you could be yourself at work? And we definitely try to make the discussion centered around people feeling comfortable and able to make a suggestion. We definitely aren't saying we've got all this right, we think we're great, we everyone's included, aren't you? It's a really difficult thing to put you know, to be able to speak on everyone's behalf, I think. But what we're trying to do with the trainees a lot of the time is to talk about whether they would feel able to make a suggestion, or whether people would feel comfortable to put forward a new idea, or to say why somebody might feel excluded. So that always generates a really nice discussion, and it really helps them when they come to choose their evidence that they might put forward. And I think, as Sue mentioned, the expansion of the standards on this module has helped quite a lot, because on the previous version, the version 4 portfolio, just the 3 standards, very broad, didn't say anything too specific. I think people sometimes struggled for knowing what to write, whereas now there's a lot more standards, they're a lot more specific, they break things down, and it does help the trainees think, okay, if I need to talk about this, what can I say, and how does this apply to me or to my particular workplace? So looking at the standards and going through them as they're producing their evidence is really, really helpful. So if you haven't got onto the version 5 yet, do have a look at those in the module descriptors document, because I think it really helps people to come up with ideas of what they might cover. What we also do is we give them some suggestions. So of course there's the mandatory piece of evidence where they need to talk about their experiences and their practice. We have a set of questions for evidence too, and the reason that we do this is because it helps to guide people through what we think is key content, such as the Equality Act, the legislation that goes hand in hand. How do trust and organisational policies link into that? We ask them to talk about some specific examples, and we also point at things such as the freedom to speak up guardian, which I think all trusts will have, and some non-NHS organisations might have that as well, and how that links in with EDI activities and policies. And then these are the suggestions for evidence that we give to our trainees. It's by no means an exhaustive list. I'm sure some of you would have other examples of things that you suggest people do as evidence. Please share them in the chat if you do. This is always one of my favourite modules to see as a verifier, because you get such a variety of ideas that people put forward and use for evidence. But we try and give some ideas so that people know, or people can think about what they might do for their evidence. I also put this list in here because as a verifier, it's one of the modules where I think some labs struggle a little bit. Sue and Tahmina may disagree, but this is a module where I often find the 3 pieces of evidence kind of say the same thing 3 times, or there's a bit of a repetition because people perhaps aren't really sure what to do other than to talk about the legislation and the policies. So these are just some suggestions that I wanted to share, but as I say, if you have others, please pop them in the chat. We asked the trainees, it may be to look at the employee support services that exist in an organisation. How do they support people to manage their work and their life and commitments that they might have? We asked them to look at their own leadership qualities and behaviours, maybe do a SWOT analysis, maybe something different. But I think relating to what Sue was saying about allyship also links into the standards on leadership and leadership at any level, which is one of the newer things that perhaps people aren't quite so used to yet. So we try and link those together as well. I've mentioned the Speaking Up Guardian and Champions. We also look at how does the wider hospital try to make services accessible and inclusive for patients, visitors, staff members. And there can be really simple examples. It doesn't need to be anything groundbreaking, but just trying to get the trainees to go out and notice what things are available to create an inclusive environment for people that might come into the organisation. So I hope that was useful. I think that's my last slide. It was a little bit rambling, sorry. But I think it's a difficult thing to come to new in the training system, but we try our best wherever we can to link it to other elements of the portfolio and to elements that are provided by the organisation. So mandatory training modules, for example, are a good place to start, and then to build on that by asking the trainees to think about how do they personally sort of enable or enact that in their everyday work, and looking at their teams and how they can talk about how diverse their teams are and why that's a positive thing for the department.
Thanks, Vikki. Catherine's managed to pop something in the chat. I know it might take people a little while to write down their examples of things that they're doing. So Tahmina, do you want to let people know what we've been doing to support this area, and people might be able to jot down things that they do for that particular module? That'd be great.
Yeah, thank you, Sue. For those of you who have joined today and might not be aware, I'm the EDI lead for the IBMS. So when I first joined council, I expressed an interest in kind of launching an EDI working group and do some work around EDI. So we started off with looking at some of the results of the benchmarking exercise. We had to look at some of the areas within the IBMS involved in kind of communications and marketing, the membership, awards, prizes, the education and training, lots of different areas. So we looked at that report and kind of put together some actions where we knew where we needed to make improvements. So some of the things that we've been working on in the background, and you might already be aware if you've been visiting the IBMS website, we have updated the EDI webpage, so you can have a look on there, and there's lots of different resources that you can have access to. It includes the updated EDI policy and also lots of resources for CPD. So you can see on the slide some screenshots I've taken from some of the kind of resources that we've made available. We are adding to that continuously. So if anyone does come across any useful resources or has anything within their workplace that they'd be happy to share with us, please do send them our way. Last year we did deliver an IBMS support hub session on EDI, and there were a few people who came forward that wanted to help with gathering some resources. So we're using those, checking them and then uploading them on the website as and when we can. They might also be useful for some of you trainees or some of you that have attended today for CPD, as well as using it towards the IBMS registration training portfolio. The EDI working group did meet with Dr. Dean, who works at University of East Anglia and is working on a project called Access All Areas. And this involved conducting a survey where 152 people took part. This included disabled scientists and anyone with an interest in disability access. And actually, they found that there was lots of discriminatory practices, not just around the work environment, but lots of things around the mobility access, things like web pages and conferences being inaccessible. So she has delivered a webinar. I've just included that in the slide. So when we share these, anyone who's interested in watching that webinar can do. But it's really useful because they do actually talk about some of the solutions to improve the work environment so that labs can benefit from the diversity and expertise of disabled scientists who are rarely recruited. So if anyone's interested, we can share these slides and anyone can watch that webinar afterwards. One of the things that we've done recently as well is a couple of years ago when we sent out a membership survey, a lot of members expressed an interest in raising more awareness around disabilities. So if you receive the Biomedical Scientist magazine, you'll notice that every month we have an EDI feature. And we've been doing that since we launched the EDI working group. We have a monthly article that comes out focusing on different topics. So what we did a few months ago is looked at what kind of articles have we published in the last couple of years and kind of categorise them. So you can see on the slide the different categories on the right hand side. So we did a count of which articles fell into each of these categories, and we actually found that the articles that focused on disability came out the highest. So we are going in the right direction in terms of what members want. There's lots of work going on in the background as well. So some of the things that we've got planned for the next year, well, this year as well, we've got the London Pride Parade that's coming up. We've just recently completed the latest benchmarking exercise that's been submitted. So hopefully we'll get a report in July, and then we can look at what areas we've improved in and what other actions we'll need to take to keep on developing. We're also looking at developing in terms of reference for the EDI working group. So initially we kind of started off kind of sort of like an informal group from having representatives from each of the different regions. But more recently we want to make that formal. So we are developing a document with the terms of reference. We're doing lots of work in outreach and engagement activities, so visiting lots of schools, lots of branch activities as well, which you might have seen in some of the articles that we have been writing about, and even on social media. We are looking to collect data as well once the new website is launched, looking at data, gathering data for our membership, and then looking at how we can use that again to improve some of our actions. And also looking to continue building the EDI CPD resources that are on the IBMS website. So yeah, that's just a very quick overview of the things that we've done and some of our plans. Stop sharing. And happy to answer any questions.
Lovely. Thank you, Tahmina. Thank you, Vikki. So if anybody wants to ask anything, I have unmuted everybody's microphone. If you want to just pop your hand up, you can ask us anything you want to. Might be a good time to ask for any advice or help if you are thinking about pieces of evidence, because Vikki and Tahmina are really experienced. So if you're a little bit stumped with what you've been doing with your trainees or with your apprentices or placement students around the EDI module, we've got 5-10 minutes to be able to pick brains and share good practice that people are already doing. So has anybody got any particular questions they want to ask, or has anybody got some experience they'd like to share about what they've done and they think it worked well? Catherine?
Hi everybody, can you hear me?
Yes, we can hear you fine.
Okay, so this is just this has happened to me twice, and I just would be interested to know what you would think. Obviously, pregnancy is a protected characteristic, and twice it's happened to me where people have found out that they are pregnant, but then not wanted to share that with anybody. And obviously, in the early stages, they've been very fragile. They've been not well, they've had brain fog, sickness, not been able to attend work very well. And so that was really difficult to handle, because obviously, you know, that is their prerogative to keep that private to them. But obviously, working in a laboratory where we rely on everybody being fit and well and healthy and able to do their job, that was quite a tricky situation to manage, because I knew that if they declared that they were pregnant, everybody around would cut them a lot of slack. I know they would, because we're all very, very, especially women, are very, very sympathetic to that. But obviously they wanted to keep that information private. And so I found that quite tricky to deal with, because of course, one of the first things that I would do as a manager is to do a risk assessment for them. But they didn't even want the health and safety rep to know. So I was left in quite a tricky situation, because I knew that we had to do that health and safety audit on them, which I did in the end to make sure that they were kept safe. But it was then quite difficult to manage that very sensitive situation within the laboratory without other people thinking, why are they behaving like this, and why aren't they doing the same as everybody else? I'd just be interested for a little bit of information actually, and help.
I'll hand over to Vikki and to Tahmina, but did you ask Catherine for any advice from your HR colleagues about your particular trust, and if there's anything that they could advise you on from their point of view?
Actually, I didn't. And as it transpired with both of them, as the pregnancy progressed, they did then feel quite happy declaring that to everybody. and there were complications for both of them around why they might not wanted to have told people. So I must admit, I didn't go to HR, but I found myself in quite a dilemma, because I had a lot of sympathy for these girls, and I wanted to make sure that they were safe and we were looking after them. But obviously I didn't have the opportunity to explain to the rest of the team why they may not attend work first thing in the morning, or they may need more frequent breaks, or they may not be able to handle certain chemicals or something like that.
And I think the risk assessment is a really important thing, isn't it, Catherine? So you've ended up taking that on as your own work, but clearly that needs to be done, doesn't it, to keep them safe? But yeah, it's tricky, isn't it, if they want to keep it confidential until they get past a certain number of weeks or months. So Vikki or Tahmina, in your experience in the workplace, have either of you come across that situation before? And have you got any advice if anybody else found anything similar? Vikki, you're nodding. I'll come to you first.
Yeah, I've been similar to Catherine. When I was a lab manager, had a staff member or a couple of times, and similar to Catherine, really. We have to respect what people want. I think the conversation is just kind of setting out to them, so you can say, people would understand if we could say it, and I think as long as that conversation has been had and they can sort of see why sharing the information might be useful, it's their decision, really. So if they're taking it kind of with that knowledge, then but you kind of have to respect what they want. I would say the same, that HR can sometimes be supportive. I think it depends on the environment as well, and I guess as part of this of more having the team that can say, oh, if things change for someone, maybe I should think about, why. There's usually a reason. But I think it's like managing other things. There's an element of, as long as the person that you're kind of responsible to knows and has made a decision, you want them to trust you as a manager that it's not unfair, it's not going to be something. So it's about the whole culture and environment that I think leads up to that situation. So that people have a bit of understanding, and if they trust you to make the right decision, and they'll probably find out information later if it helps. It's not the easiest thing to do, but it might apply to other things. People might not want to share various pieces of information about them that actually may help their colleagues understand, but that's still up to them as to whether they want to share or not. So just open conversations, I think, are the main thing to start off with.
Yeah, I can speak from personal experience. This happened to me, and I did go and speak to my manager, and I said I wanted to keep it quiet. But I think after the first week, I just felt like it would be easier just to say something, because I experienced really bad sickness, and I just thought it was going to become obvious anyway. And actually, it was taking more energy to keep quiet about it than actually, just being open about it. And I'm glad I did, because my colleagues were very, very supportive. But I think coming back to your situation and kind of advice, I would absolutely reach out to HR colleagues. But again, I understand, of course, if your colleague has asked you not to even speak to HR, then I would personally say to my staff that you can trust me to keep it confidential. But obviously, if you're coming in late and there's lots of different tasks that you're not taking part in for your own health and safety, it might become obvious to the staff. So although I will keep it confidential, it might become obvious to the staff members why you might not be taking part in certain things. So I'd ask them to reconsider whether they think it might be easier just to be open with it. And if not, and they want to keep it quiet, that's absolutely fine. But people might be aware.
They might work it out.
Yeah, exactly. Yeah. But just to assure them that it definitely hasn't come from me, and I've kept it confidential.
And maybe just a conversation, Catherine, to say we can keep it confidential, but just people need to know that I know that I've said it's okay if you need to come in late or you're not doing certain things. So as a manager, I am aware that that's happening, because that might have an impact on other people's workload. So you don't want the rest of the team thinking that they're just not doing something and you don't know that's happening. So maybe a conversation around, we can keep the reasons confidential, but I think it's important to say to the rest of the team there's going to be an adjustment for a period of time, just so that everybody's clear that you do know. So does that help?
Yeah, actually, that's really helpful because, you know, you're between a rock and a hard place, aren't you? And one of these people was actually in training at the time,
Mm,
and the person who was training her was getting really frustrated
mm,
because she kept you know, just brain fog and
mm,
confusion, and you
mm,
know, she was in a trainee position,
mhm,
and that person would then come and say to me, you know, I'm really concerned about this person. We've
mhm,
been over and over and over this piece of
mm,
work, and
mhm.
it's not going in. And it was just on the obviously I never divulged anything, but you
Yeah.
know, I just thought, my goodness, if they knew, then they would cut
Mm,
this person some slack. But that's
mhm,
really useful actually, to actually say, I really like that I do know, and we are making some concessions at the moment.
mhm,
And as Tamina said, it's quite obvious, you know, if you've got a young woman behaving like that, you know, after a while. But again, you know, we need to keep EDI in perspective, don't we? Because we shouldn't make assumptions. We
mhm,
shouldn't make assumptions, oh, that young
mhm,
girl is feeling sick, therefore she must be pregnant.
mm,
That is absolutely the opposite of what we should be doing. But I
mhm.
mean, I think, you know, and especially I think the older ladies in the department, the pregnancy antenna were twitching. I think they knew.
Sixth
Okay.
sense.
No, but it's, you know, this is something that obviously as a manager you do frequently have to deal with, isn't it?
Mm,
Something that somebody comes and tells you,
mhm,
but they actually want to keep it private. But
mm, mhm.
actually it's going to affect the team.
Yeah.
And you know, you have to be very, very cautious in how
Mm,
you behave and keeping that person safe and making them feel that they can divulge that information to you without you ever you know, divulging it to anybody else. Thank you.
mm.
Thank you.
No problem. I'm conscious of time. We are getting very close to 1 o'clock. So if anybody else has got anything they'd like to ask in the next minute or two, please pop your hand up, and we can help you with that. If not, while people are having a little think, what will happen is the video for today's session will go up on the web page in a few days' time. Our comms colleagues will just edit that and put it on. So that will go up very soon. If you've got any colleagues who couldn't come today, you can point them towards it. Thinking about pieces of evidence, you can use this particular resource, can't you, Tamina? So we like people to refer to the EDI pages and the support hubs that we've done. So you could reflect, get someone to reflect on having engaged with this and what they've got out of it, and that could go towards a piece of evidence as well. So yeah, we can have a think about that. So I can see you've just popped your hand up, Drova. I know you've got a question in the chat, so I can come back to you about that later if that's what your hand up is about. Okay. So if there's no other questions, then I suggest we draw the session to a close, and I'll reply to your question in the chat after the session. Thank you very much for joining us, everybody. I'm really pleased that you could join us, and I hope you found it useful. The video and any resources will go up on the webpage in a few days' time, so you can go back and review or signpost it to others. Thanks very much. Nice to see everybody.